This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Stefan Glück, professor in the Department of Medicine, Division of Hematology Oncology at the Sylvester Comprehensive Cancer Center, University of Miami, Leonard M. Miller School of Medicine. Hello, Dr. Glück.
Hi, thank you very much, Selma, to having me again.
Let's talk about something else. It's BRCA mutation and its prevalence amongst triple-negative breast cancer patients, and what this means. And again, you know, triple negative, we were talking about when we started our discussion today, that breast cancer is not just one disease. And here we are learning more and more about triple negative breast cancer, and that's a hard diagnosis.
Yeah, so triple negative breast cancer, in a different setting and different sense, also is a double-edged sword. Why? Because if it's successfully treated and caught early, actually is one of the few breast cancers that we can call a cure about. They extremely rarely, maybe never, recur after 5 to 7 years. Unlike ER positive or HER2 positive disease, they have recurrences 5-10 years later. So in this regard, it may be sometimes good or better. I'm not saying, and no cancer is good, of course, but better. On the other hand, if it recurs, it becomes very difficult to treat for two reasons. Not only that we do not have yet, I must say, targets that we can create compounds specific to this type of cancer, but it usually also is often very resistant to our only option we have, chemotherapy. So treatment works for a while, but a short while.
Would you please explain for viewers who don't know what triple negative means?
Yes. As we discussed in the very beginning, we have the traditional three markers: the estrogen marker, estrogen receptor, progesterone receptor, and HER2. And if 1, 2, 3, all three are negative, we call it triple negative. So we cannot use anything against estrogen, and we cannot use anything against HER2. So these compounds are not available for these women. Turns out these women who have triple negative breast cancer is a very specific subset. Why? We see triple negative breast cancer often in women who have BRCA1 mutation, sometimes in BRCA2 also, but predominantly in BRCA1 mutation. Who are these people? First of all, BRCA mutation is not a mutation or a gene in the cancer. It's the gene that you and I all have. If it's mutated, then people, healthy people who have BRCA mutation, are susceptible to developing cancer. BRCA1, up to 80% of BRCA1 carriers or mutated people actually develop breast cancer, and up to 60% ovarian cancer. So there is already a connection. Why it is so, it takes me a longer time to explain, but maybe I can do it. BRCA encodes for a DNA repair enzyme. So as we all are bombarded every day with some kind of damaging agents, whether it's smoke or radiation or light or toxins where we drink and eat, whatever it is, there will be a DNA damage in some cancer, in some normal cells. If the damage is huge, the cell dies and nothing happens. If this damage is intermediate or little, then the DNA repair enzymes repair it and the cell is normal again. But if it's kind of not quite one of these two extremes, it can be in part repaired, or if the repair enzyme is missing, BRCA1 mutation cannot be repaired, and it's not so serious that the cell dies, this cell becomes a cancer cell. So that's why BRCA1 mutations have, mutated carriers have more cancer. It's a very simplistic explanation, but I think it hits exactly what it is. And turns out triple negative is very high prevalent in these patients.
And the PARP inhibitor is one of the clinical options for these patients?
It might become in the future. It's another different DNA DNA repair enzyme like BRCA. And if two enzymes are targeted, then it should be, could be, might be, will be successful.
What I'm gathering is that these BRCA1 in particular, patients with triple-negative breast cancer, there are clinical possibilities that are in the works to respond directly to their genetic profile.
Yes, that is very correct. Studies are ongoing. Some of them are very promising. And in the general population, BRCA is mutated in about 4%. In women who already have cancer, particularly triple negative, and that was your initial question, it is about 12%. In African Americans, it's almost 20%.
And now you as well in Miami have a cohort of patients, Hispanic patients.
Correct.
What are you learning in particular at your university?
Yeah, it's quite interesting. The population in Miami is very diverse, and about 60% are Hispanic, and about 75 are Latin origin. And part of them are also islanders. So we discovered not only that some of the Hispanics have higher BRCA mutations, hence triple-negative breast cancer, but also Bahamian women tend to have more of these cancers. And the numbers are close to what I just mentioned, 20%. So it's 4 or 5 times as high as in the general population in, let's say, United States.
However, is the BRCA mutation in the Ashkenazi patient versus the now Bahamian patient versus the African American or the Latin patient, are they all different?
Probably. Yeah, we don't know yet the details, and obviously in Ashkenazi Jewish they are very, very closely related, all these mutations, and probably it will be the same for the African American, have different. So as ethnic groups are more diverse the mutations will be, and the more diluted they are, and the more coherent the ethnic communities are. Like in the Bahamas, there's not many people, there's not even 1 million people. They're all kind of sooner or later related, so it adds some of the genetic mutations.
I'm wondering about the common thread. I don't know if this is applicable or not, but I understand, going back to the Ashkenazi Jewish BRCA mutation, this probably grew out of being put in pogroms and you know, intermarriage, or you know, much too close familial genetic reproduction. Is that similar, do you think, in other cultures?
Probably yes. Particularly, as you said and I said, for the West African, which is the majority of African American descent in the United States, from West Africa. So this is probably what it is. And the more diverse, for example, if an African American marries a Chinese or Asian person or a European, then over time these genes will be diluted again. But if they do always the same,
yes.
I'm not saying that they need to be related, but in the same ethnic group, then it enriches for mutations.
Exactly. Thank you, Dr. Stefan Glück, Sylvester, Distinguished Professor, Department of Medicine, the Division of Hematology Oncology, the Sylvester Comprehensive Cancer Center, University of Miami, Leonard M. Miller School of Medicine.
Thank you.